Welcome to News Hour on Aflao TV, the heart of Africa. We are transmitting live from Aflao of the Volta region. In this edition, the St. Anthony's Hospital at Joje in the Cat North municipality resumed some essential health services on Wednesday. The Member of Parliament for South Tongue has supported the Dabala Health Center with medical equipment and supplies. Across our borders, hundreds of school girls in Nigeria have been released by gunmen after being abducted. This and many more we have for you today. Stay tuned. My name is Portia Aye. Now the news in detail. The St. Anthony's Hospital at Joje in the Ketu North municipality of the Volta region will resume some essential services to the general public on Wednesday, 3rd March 2021. The administrator of the hospital, Mr. Aflao, disclosed this in an interview with our news team at Joje. According to him, the hospital has been entirely fumigated, paving the way for resumption of some services to its clients.
Anthony's Hospital, which is the municipal health facility for the Ketu North municipality, was shut down to the general public a week ago following the upsurge of COVID-19 cases that affected both staff of the hospital and a number of residents in the area. When Aflao TV crew visited the hospital on Monday afternoon, the entire facility was virtually empty as no health-related activity could be seen within the premises. The situation led to the quarantine of the affected health staff, compelling management of the facility to withdraw essential services such as OPD, maternity, and their related activities. The administrator of the hospital told our news team that the situation has been very devastating.
Just within January to 24th February, which is, I think that was Friday, we have recorded 64 cases, confirmed cases, of which 14 had recovered as at Friday, and 40 were still active cases. About 217 samples as at the time were still at the lab. Their results were still pending.
The shutdown has affected commercial and other activities that heavily rely on the hospital's operations. Mr. Tumawu stressed the need for the general public to continue observing all the COVID-19 protocols so as to stem the spread of the disease.
Initially, we planned that this would go on for 2 weeks, but currently, God willing, by Wednesday, we will resume emergency and OPD services and also gradually open the hospital up to admissions. We know COVID has come to stay, and we have to put in measures to break the chain of infection. So what I would advise the public is that we should continue the protocols which were outlined. That is the frequent hand washing, social distancing, use of alcohol hand wraps, and also ensuring that at all times we wear face masks.
The Member of Parliament for the South Tongue constituency in the Volta region, Wisdom Kwabinamesa, has presented a number of medical equipment and supplies to the Dabala Health Center at a brief ceremony at Dabala. The items, valued at more than 100,000 Ghana cedis, is one of the biggest donations received by the Dabala Health Center in recent times.
The Dabala Health Center is one of the major health facilities in the South Tongue district. Apart from serving the health needs of the people, clients also patronize the center from nearby communities such as Twekuma and Blamazado in the Anloga district. The items presented to the facility by the MP included fridges, hospital beds with drip stands, centrifuge, electronic balance devices, as well as laboratory seats and microscopes. Printers with their accessories, laboratory reagents, as well as desktop computers also formed part of the package. Some of the equipment is also meant for use at the Dabala Health Center laboratory, which is almost complete. Making the presentation, MP for the area, Wisdom Kobena Mensah-Woyome, said he is committed to ensuring that the health needs of the people are well taken care of.
Some of the facilities at the primary level, so that at the end we reduce the traffic at the secondary, which is the district hospital and as well as Kumbuni Hospital. The project was embarked on to ensure that we have labs at least built in many of the facilities, and one of these facilities is the Dabala Health Center. And so we are here to donate these items to furnish the lab, which is almost complete, which we are likely to commission hopefully in a month from now. This, I must say, is not the end, but the beginning to extend similar gestures to other facilities. Key amongst them include Potame Health Center and as well as Aduto. And some of those other ones that are in Agave areas, the hard to reach areas, so that at least we can be able to get them things that will help improve on healthcare delivery and also to make the work quite easy for your staff when they are carrying about their duties. And we are going to do much more going forward.
District Director of Health Services for the area, Mavis Agume, was grateful to the MP for his continuous gesture and support to the health sector of the district.
We are very happy for those items donated to us. We promise you that these items will be used for the intention that it has. We pray to Almighty God that He will continue granting you good health so that you will continue doing more for health sector in South Tongue. We once more promise you all these items will be put in a good use to improve on service delivery in this district. Thank you very much.
The physician assistant in charge of the center, Bright Daku, noted that the donation would go a long way to impact positively on quality healthcare delivery in the area.
And because of the services and our reception to clients, we have a whole lot of clients that come from even other districts, even from Keta municipality, Blamazado, what's the name? Twekuma and Co. They all come here. From even we get some clients from even Sokakoko coming to see us here because of the crowd at the district hospital and the Vichanabati hospital. So apart from those two big hospitals, this is the next one in mind.
Still in the health sector, Medical Director of the St. Anthony's Hospital at Joje in the Ketu North municipality of the Volta region, Dr. Samuel Folson has called on Ghanaians to accept the COVAX AstraZeneca Oxford vaccine towards curbing the spread of the coronavirus in the country. According to him, the vaccination of the century with the 600,000 doses currently in the country is a major positive step by government and all stakeholders to deal with the pandemic. Speaking to our news team in an interview on Monday at Joje, Dr. Forson said the vaccines are safe for use by Ghanaians.
On 24th February 2021, Ghana made history to become the first African country to take delivery of 600,000 doses of the coronavirus vaccines through the COVAX facility. Before the arrival of the vaccines, many skeptics have raised concerns regarding the safety and efficacy of the vaccine despite all assurances from both the government and health officials. As part of efforts to assure Ghanaians of the safety of the COVAX AstraZeneca vaccine, the President and his vice, as well as their spouses, took the first doses of the vaccine on Monday, to be followed by other prominent individuals of the country. Former President John Dramani Mahama and his wife on Tuesday also took the first dose of the vaccine. The medical director of the St. Anthony's Hospital at Joje has welded into the debate, calling on Ghanaians to accept the vaccine. In his view, the COVID-19 situation is alarming, adding that getting a vaccine for the pandemic at this time is a step in the right direction.
Oh yes, I would say kudos to our leaders and the government for having being the first country in Africa to acquire these vaccines. It's a step in the right direction. It deserves to be commended for that.
Dr. Forson pointed out that the introduction of the vaccine is not a panacea to ending the pandemic, adding that the general public should continue to adhere to all the health protocols associated with the virus.
Yes, the all-important vaccines are in. I will encourage everybody to take the vaccine because it's only through the vaccine that we can get immunity as a country as a whole. We can only all get immunity if we all take the vaccine. The vaccines are safe. The FDA has reassured us that the vaccines are safe. So I will encourage everybody to take the vaccine so that we can get quickly through this pandemic and return to our normal life.
Let's go for a quick break. We'll be right back with sports news. It's time for sports here on Aflao TV with me, Rebecca Oklu Akoli. Now to the stories. Former Black Stars midfielder Michael Essien has become the first football star in the country to openly declare support for the lesbians, gays, bisexuals, transgender and queer group in Ghana. Essien, in a social media post, assured the group of his support and urged them to continue fighting for their rights. The post was, however, deleted after it attracted backlash from some Ghanaians on the platform. The LGBTQ canker continues to be the raging topic on Ghanaian media platforms, despite the President Nana Dankwa Akufo-Addo being emphatic on his position. Under no circumstance will same-sex marriage or relationship be legalized in the country. The president, who had in recent times come under pressure from religious institutions, said in his response that homosexuality will not be legalized under his watch. I will not be under the presidency. It will not be under the presidency of Nana Dankwa Akufo-Addo that same-sex marriage will be legalized in Ghana. It will never happen in my time as president, he stressed. Now moving on, the Black Satellites of Ghana will engage Uganda in the final of the 2021 African Cup of Nations Championship. Uganda defied the odds to book a maiden FIFA World Cup post following a 4-1 win against Tunisia in the semi-final on Monday. The Hippos are the surprise package of this year's finals, having beaten fancy opponents like Mozambique and host nation Mauritania in the tournament. Coach Mole, the Chrysals men have booked a date with Ghana in the grand finale on Saturday. Ghana advanced to the final round of the tournament after pipping a Group C opponent Gambia in the semi-finals on Sunday. Uganda will need more of that ingenuity and luck against the West African giants at the State Olympic on Saturday. This brings us to the end of today's sports news on Aflao TV. I am Rebecca Oklu. We take a breather and international news. We'll be back with Portia Aye. Welcome back from that break. Now moving on to foreign news. Nigeria due to receive COVID-19 vaccines on Tuesday. Neighboring Nigeria, which is due to receive its first batch of COVID-19 vaccines on Tuesday, has reported 360 new COVID-19 cases and 8 related deaths. The overall case load in the West African country has now reached 156,017 infections and 19,015 deaths. Nigerian Health Minister Osagi Ehini launched on Monday a nationwide COVID-19 vaccination strategy dubbed as Stitch. By this move, the African most populous country has become the next country to push for the receipt of the coronavirus vaccines. The Nigerian Health Minister noted the safe and effective COVID-19 vaccines is a critical part of Nigeria's strategy to encounter the pandemic and stop transmission of the virus. According to him, this is the only way the country can achieve herd immunity to stop the community transmission of the deadly virus. According to the COVID-19 Presidential Task Force, 3.924 million doses of the vaccine developed by Oxford AstraZeneca are expected to arrive at the Nnamdi Azikiwe Airport in the capital, Abuja. The first phase of the vaccination drive will cater to fourth-line health workers. Phases 2, 3, and 4 will target the elderly, those who suffer from 2 or more diseases, and citizens between the ages of 18 and 49 respectively. The National Agency for Food and Drugs Administration and Control will analyze a sample of vaccines on Tuesday and Thursday, while the campaign is expected to begin on Friday. Leaders and top government officials will get vaccinated on March 8. Hundreds of Nigerian schoolgirls released by gunmen. A group of nearly 300 girls who were kidnapped from a school in northwestern Nigeria last week have been released, a local official said. The girls were abducted by unidentified gunmen from the bordering school in Tangbani, Zamfara State on Friday and taken to the forest, police said. The state governor said on Tuesday that the group has been freed and the girls are now safe. Dozens of the girls were seen gathered at a government building in Zamfara after they were taken there in a fleet of minibuses. The authorities said 279 girls had been freed, adding the figure given last week by the police that 317 had been kidnapped was no longer accurate. One official told Reuters news agency that the discrepancy was because of the fact that some girls had fled shortly after being adopted. The group's release was secured through negotiations between government officials and the adopters as well as authorities in the Zamfara state, the BBC report said. Nigerian President Muhammadu Buhari is overwhelmingly happy that the girls have been released without any order or incident. We'll be right back after this break. Welcome back from the break. That's all we have for you today on Now and recap of the headlines. The St. Anthony's Hospital at Joje in the Ketu North municipality resumed some essential health services on Wednesday. The Member of Parliament for South Tong has supported the Dabala Health Center with medical equipment and supplies. Across our borders, hundreds of schoolgirls in Nigeria have been released by Ghana after being adopted. All thanks to my production team. Thanks for watching. My name is Posha Aye.